Welcome. Thank you for tuning in to this presentation from the Choices Community of Practice. The Choices Community of Practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. The goal of the Choices Project team is to support these efforts by providing tools, resources, and training opportunities. We hope you enjoy this presentation and find it informative. Thank you for joining us.
Hello. Today I'm going to discuss costing perspectives, principles, and activities, which are key components of the Choices model and framework. There are 3 learning objectives for today's discussion. By the end of this presentation, you should be able to understand why cost analysis can be useful. In addition, you should be able to describe key costing perspectives and principles used for the Choices modeling. Finally, you should be able to explain the Choices methods and approaches for defining and identifying strategy components, activities, and resources. Cost analysis is an important part of Choices, and one of the reasons is that there's actually quite limited costs information about public health interventions, particularly the type of interventions that Choices focuses on. And so it's an important step in building an evidence base. It's also a tool for implementation and feasibility planning, and increases the transparency with regards to health investments as it provides funders with additional information and can inform prioritization by demonstrating which strategies offer the best value for money invested. Cost analysis involves looking at both the payer and the societal perspectives. The payer perspective is a narrow perspective from the lens of a single payer, such as a hospital or a department of health. Costs and resources impacting other payers are not considered in this perspective. The evidence base includes clinical strategies from a healthcare payer perspective. For example, a strategy to reduce screen time in early care and education might use the perspective of ECE as the payer. From the ECE provider's perspective as the payer, the cost would include communicating changes to parents, training staff, and materials such as handouts or other supplies for the strategy. When a cost-effectiveness analysis is done from the societal perspective, the analyst considers everyone affected by the strategy and counts all significant health outcomes and costs that flow from it, regardless of who experiences the outcomes or the costs. In this case, costs include not only medical and other resources, but also the time of patients and unpaid caregivers, which can be monetized. In contrast, cost-effectiveness analysis done from other perspectives can reasonably omit some of the outcomes and costs if they are not of interest to that decision makers coming from that perspective. The societal perspective is supposed to include all costs, regardless of the sector of the economy they fall under. In a healthcare cost-effectiveness analysis, we often consider only the costs of the healthcare sector. In most cases, this is where most of the costs lie. For Choices, however, we consider costs in many different sectors: education, social services, health, etc. However, one thing that the societal perspective says we should count, but that we may not always count in choices, besides patient time, is economic productivity. It's common for analyses that are taking a societal perspective to put some limits on the scope of their analysis in order to make it manageable. We need to define the boundaries of an analysis in a reasonable way that captures everything that we think is essential for the decision at hand. For example, a strategy to reduce screen time in ECE from a societal perspective would have to include all relevant perspectives, because all perspectives are part of society. So this would include the role of federal, state, and local governments and their participation in the program in terms of administration, training, technical assistance, monitoring, compliance, and perhaps some communication activity. Another organization would be the ECE providers themselves, who would have costs or resource use associated with the change in practice, training, and any material costs. And then there would be potentially consultants from universities or other organizations that may provide assistance in the training or in the implementation in some way, and their labor costs would also have to be accounted for. Sometimes we refer to a modified societal perspective, and this is usually when a societal perspective is taken, but costs for the patients or participants of a intervention are not included, particularly the value of their time is excluded. Because it's difficult to measure the value of the time of children participating in these kinds of programs, we exclude that in choices, but we don't think it's a major component of the overall costs. So a modified societal perspective isn't really that different than the full societal perspective in this case. An example of a modified societal perspective would be one that included the time spent by teachers in training, learning how to lead a structured physical activity in an after-school program, for example. It would not include, however, the time spent by the child attending the after-school program. Here are some examples of potential payers in a modified societal perspective. The resources contributed to making an intervention successful could come from any one of these sources or several of these sources. Incremental cost is a key costing concept. The incremental cost concept simply refers to the change in cost associated with taking one action compared to another. So in a cost effectiveness analysis, it is only this change in cost that we must measure. In some cases, we do measure the full cost of action A and the full cost of action B, and then subtract one from the other to calculate the incremental cost. Sometimes it can be difficult or time-consuming to estimate the full cost of different programs. When it's hard to measure the full costs of programs, oftentimes we'll take a shortcut because we're able to get a good estimate, at least, of the incremental cost of one program compared to another, and we'll just focus on measuring that. This saves us from having to measure the cost of things that are going to be constant regardless of whether action A or B is taken, and which will ultimately cancel out of the calculation. Sometimes knowing the full cost is important, though. For example, if neither action A or action B have been implemented yet, the incremental cost of B compared to A can be useful for making a decision between A and B, but you still might want to know the full cost of implementing each for planning purposes or for fundraising purposes. So here's an example of an incremental cost. Replacing white bread with whole grain bread. The incremental cost here would be the difference between the old cost of the bread and the new cost of the bread. So in this case, it would be an increase of $2, which is the difference between the cost of the whole grain bread and the white bread. Opportunity cost is another key concept, one which I've already referred to, but now we'll take the time to explain. The basic idea of opportunity cost is that a resource has value because it could be used for something else. When you use a resource for some purpose, such as some kind of obesity prevention intervention, that resource is therefore not available to be used for something else, and you're foregoing whatever gain could have been accomplished by using that resource in its alternative use. That amount of benefit that you could have achieved in its alternative use is basically the cost of using the resource in the way that you did use it. Economic theory says that in a well-functioning market, that is to say a competitive one where all the participants have full information and there are no externalities, the price of various products and services will equal their opportunity cost. That's why for most resource inputs, we can use their price as an estimate of the value of that resource. However, in some cases, price can be a bad proxy. For example, when the market is not a well-functioning one. In these cases, we may have to use some other method to estimate the value of resources. And in some cases, we have resources for which there may be no market at all. For example, a volunteer's time has value, but it's not an easy or obvious thing to estimate. It is labor that, by definition, is not exchanged for money. It's just provided. But it's still a scarce resource, and it's one that has some alternative use. The volunteer could volunteer for some other activity, or they could choose to relax on the couch, or they could choose to work more hours in a job, perhaps. So they do have alternative things they can do with their time. There is an opportunity cost, and our challenge is to figure out what it is. For volunteer time, we sometimes use the market rate for similar work. So if the work was not done by the volunteer, what would it have cost to hire someone to do that kind of work? Here's an example of an opportunity cost. Replacing an annual professional development training for bullying prevention with a training for active PE. Even if there's no additional expenditure on professional development, the spending that is going towards the professional development now should be allocated to the active PE program instead of bullying. A cost of the active PE intervention is the foregone opportunity to teach about bullying prevention. Another important concept is the idea of cost savings or cost offsets. Cost savings or offsets are costs that are not necessary to make a strategy happen. These are changes in cost or changes in resource use which are a consequence of implementing a strategy. The best example in our case are the averted costs of treating obesity-related health conditions. If obesity is prevented by some intervention, then downstream in the future, some obesity-related health conditions may be averted, and the costs associated with caring for those conditions will be averted as well. From a societal perspective, we usually take a medium to long run view that focuses on the present value of a stream of total cost impacts over a fairly long period of time. Individual payers may care about short to medium term budget impact. You can imagine that in the short term, you might not actually see all of those cost offsets or cost savings accrue because they happen farther in the future. But sometimes it's useful to track different types of costs separately. We might want to focus on separating implementation costs from downstream cost offsets. Implementation costs would include the resources that are actually required to implement or deliver a particular policy. This would include startup activities as well as any ongoing operational costs necessary to deliver the intervention. And this cost is incremental to whatever the status quo is, and it could be positive or negative. This is distinct from downstream cost offsets, which are the result of having implemented a strategy. These are sometimes called offsets because these long-run savings on treatment offset the upfront spending on the prevention strategy. But of course, it's important to keep in mind that it is possible to have negative cost offsets. In other words, to have an intervention lead to higher costs in the future, something that induces additional costs downstream. So here's an example of cost offsets. An after-school program receives reimbursement for the provision of snacks that meet NSLP and CACFP guidelines to all children. The program restricts the foods brought from home, so families previously sending snacks with their children no longer have to purchase snacks. The cost offset is a savings to the family of not having to buy those snacks. Notice that the implementation of the program doesn't depend on the family buying or not buying snacks. The change in the spending of the families on snacks is merely a consequence of the program. There are certain costs that are not included in choices. These include resources used for the original design and development of strategies, researching policy options, advocating for a policy, regulation, or guideline, or writing legislation, evaluating the effectiveness of a strategy, so collecting height and weight data to measure outcomes after a strategy has been implemented. In general, these types of costs are not included. In some cases, they're not included because they're sunk costs. In other cases, they're not included because they're not fundamental to the value of the intervention itself. Let's now take a look at the methods choices would use to determine how much it would cost to implement a particular strategy in a given state or city. Our costing steps begin by defining what the strategy is, and then once the strategy is defined, we dive into determining what activities and resources are needed to make the strategy happen. For this example, we'll just focus on defining the strategy and determining the activities and identifying which resources are needed. After this step, one would move on to actually trying to measure the quantity of resources that are going to be needed and to value those resources, either using market prices or some other method if market prices are inappropriate. Let's look at a specific example. Let's use the Choices national model of NAP SACC, which is a nutrition and physical activity self-assessment for childcare programs. Our first step is to define the strategy. When we think of defining the strategy, we must answer these key questions. What is the strategy? Where is it implemented? Which populations are impacted and will benefit from it? And who is involved with the implementation for the strategy? For example, with NAP SACC, we first answer the question, what is NAP SACC? NAP SACC is a program designed to help early child care programs improve their practices, policies, and environments to support healthy eating and physical activity. The program involves child care consultants working with early child care and education program directors to complete self-assessments on these behaviors, and then developing and implementing action plans to improve practices and policies at their program. In our national model, we also looked at incorporating the NAP SACC program into the Quality Rating and Improvement System, QRIS, which would provide opportunities for programs to earn certifications in return for completing certain trainings and demonstrating other quality indicators. Then we asked ourselves, what would implementation look like? First, we need to think about where NAP SACC would be implemented. We are thinking that all licensed early care and education facilities will be eligible to implement. Then we ask which populations will be impacted or will receive the benefit of NAP SACC. We assume that children aged 2 to 5 that attend licensed early care and education facilities that implement NAP SACC will benefit. And then we have to think about who would be involved to carry out this strategy. Most strategies are administered, coordinated, adopted, and implemented on multiple levels. So for this strategy, we need to think about who administers the QRIS, Quality Reporting System, who licenses ECE programs, then who will adopt or implement the NAP SACC program, and lastly, who ensures compliance. Once the NAP SACC program is integrated, we need to think about who will attend or receive the professional development and who will agree to adopt and implement the physical activity and nutrition standards provided during the professional development trainings. Once we have determined what the strategy is and we've defined it, we then look to determine what the main activities are. We need to figure out what activities must occur in order to plan, coordinate, implement, and enforce the strategy. We have grouped the activities into these main categories. Within each of these categories, we'll need to think through what are the main activities or components. The key questions to ask yourself for each of these activities is who does what to whom when. For example, for training, who will lead the training? Who will attend the training? Where will the training be held? And when will the training happen? Or how often will it happen? And for how long will the training go on? So in our hypothetical nationwide implementation of NAP SACC that we're using as our example, we assume that the program would be incorporated into each state's quality rating and improvement system for ECE programs, and that completion of NAP SACC would be required for attaining QRIS certification. So with that model in mind, there are several key activities, and we'll just go through a few. We'll go through a few of these activity categories to explain some of the detail that we need to think about. So in the training category, the NAP SACC program would involve training a core group of child care health professionals to work with ECE programs. There would be sort of a state level master trainer to lead these trainings, and they would be training ECE child care consultants and perhaps ECE staff who attend these trainings. And they would be trained so that they would be prepared to provide technical assistance to ECE program staff who would be implementing NAP SACC Another category of activities is implementation at the ECE provider level, and this would include making modifications to programs and protocols at the provider that might involve purchasing new physical activity equipment or making upgrades to physical activity equipment. It might include some changes to improve the nutritional quality of the meals served. And you can imagine, these activities are going to take some labor time of the ECE program directors in order to implement. And another category of activities would be compliance and monitoring, and that would be likely carried out at the state level by QRIS administrators. And you can also imagine that there would be activities related to communication between the state and ECE providers and other kinds of communications between ECE providers and parents, perhaps. And there could be some activities related to coordination and oversight of the NAP SACC program as a whole, and so on. Now, once we've thought through all of the various activities that are going to be involved in the intervention, we come to the step of identifying the various resources that are required to carry out each of those activities. When we think about resources, we're talking about anything of value, whether it's an item or labor time, that is a necessary input to implementing the intervention's activities. So in choices, we break up our resources into three major categories: labor, consumable items, and equipment. Labor would include all paid as well as unpaid time that is contributed by workers or volunteers. Consumable items are materials that get used up, like food, and equipment pertains to things that are more durable, and they last over a relatively long period of time. One thing to keep in mind when identifying resources is that we're not just looking for resources that are adding to an organization's budget or new spending, but we're also looking for existing resources within an organization that are being repurposed or reallocated towards delivering a particular new intervention. And both of those should count, because in both cases there's an opportunity cost. Another thing to note is that for equipment, because it is durable and lasts a long period of time, usually we try to assign a useful lifespan to each piece of equipment and then apportion its cost over that useful lifespan. An example would be a piece of playground equipment that might last for 10 years, and so we would spread the cost of that equipment over that 10-year period. So using our example of NAP SACC again, let's just take a look at some resource identification for one activity, which is the training part of the intervention. So for the ECE staff training, one in the labor category of resources, there would certainly be labor on the part of the child care health consultant. And there would also be labor time on the part of the ECE staff that is being trained. In the category of consumable items, you could have some travel costs. So think about mileage reimbursement for the consultant, or perhaps if it's an off-site training, maybe people are being reimbursed to go to travel to that off-site. If there's any accommodations for the meeting, any rented venue space, for example, or any snacks or lunch or coffee breaks provided during the training, those would be consumable items that were part of the training. And then to just give one example, possibly it's not exactly equipment, but in the category of things that are more durable and lasting, perhaps a manual, the NAP SACC training manual that's provided to the people being trained, and that's something durable that they keep with them for a long time. So that could go in the category of equipment, or it could be treated as a consumable. You probably wouldn't amortize the cost of a manual over several years, even if it lasted several years, just because it's such a small cost as an individual item. So we sort of walked through the first three of the 5 costing steps. We defined our strategy, determined our activities, and we identified our resources. And we used the example of the NAP SACC program to do that, to illustrate that. Now, there are 2 more steps we're not going to talk about at length today, but the next step would be resource measurement, which is, now that you've identified all the resource inputs that go into the activities, you want to measure the quantity of the resources that get used. So an easy way to think about that is the hours of labor, for example, or the number of playground equipment that need to be purchased, or the number of NAP SACC manuals. And then the very last step is resource valuation. And most of the time we're going to value the resources based on a unit price, a market price. So in the case of labor, that would be the wages or salary. Typically, you would want to have a fully loaded salary being counted. And then for anything like the knapsack binders or jump ropes or playground equipment, you would typically use the market price for that. But that's it. That's basically the steps of costing. We've covered a lot today. We started out talking about the perspective of a cost analysis and how that affects which costs get included. We talked about several key concepts in costing. Particularly, we talked about opportunity cost. We also talked about the idea that costs would be broken down into different categories, such as labor, consumable items, or equipment that's durable over time. And we talked about the idea of breaking up costs and separating out resources which are required to implement and deliver an intervention from the cost implications or the cost consequences downstream of an intervention having been implemented. And then we went through the steps of doing a cost analysis, and we used the NAP SACC example to illustrate a little bit of how that's done to give you a flavor for it. So I hope that was helpful. Thanks for listening.
Thank you for tuning in to our presentation. You can learn more about the Choices Project, our research, and the community of practice by visiting our website at choicesproject.org.